Signs of inflammation. What is inflammation? Inflammation is our body's immune system responding to injury, infection, or irritation. How does it work? When cells are damaged, they release stress chemicals like histamine and bradykinin. These chemicals cause local blood vessels to widen and leak fluid into the surrounding tissue. This process allows white blood cells, nutrients, and antibodies to flood the area, fight off foreign invaders, and clear out dead cells. There are two main types of inflammation. Early type is acute inflammation. This is short-term, immediate defense by body. It starts rapidly and becomes severe quickly. For example, a bee sting, a sprained ankle, or a cut finger. It usually resolves within a few days, once the threat is gone. The later type is chronic inflammation. This is long-term, slow-burning defense by the body's immune system. It happens when the immune system fails to eliminate the trigger or mistakenly attacks healthy tissue. Known as autoimmunity. It can last for months or years and damages healthy organs over time. Now then, let's discuss the signs of inflammation. Acute inflammation is your body's immediate protective response to injury or infection. As a novice medic, you can quickly identify it by looking for the 5 cardinal signs. Memorize these 5 classic clinical signs, along with their original Latin terms. Pain. Known as dolor. Why it happens? The inflammatory chemicals, like prostaglandins, and physical swelling, directly stimulate nerve endings in the affected tissue. Novice tip. The pain might be constant, or only occur when the area is palpated, touched. Heat. Known as calor. Why it happens? The body increases local blood flow to the injured site, to bring in necessary white blood cells and nutrients. Novice tip. The affected skin or area will feel distinctly warmer than the surrounding, injured tissues. Redness. Known as rubor. Why it happens? This is a direct result of the dilation of small local blood vessels, vasodilation, near the injury. Novice tip. You will see a flushed, discolored, or distinctly erythematous area compared to normal skin. Swelling. Known as tumor. Why it happens? Chemical mediators cause the walls of the capillaries to become leaky, allowing fluid, exudate, and immune cells to flood the surrounding tissues. Novice tip. Look for noticeable edema or puffiness in the area. Loss of function. Known as Functio Laesa. Why it happens? The combination of intense pain, swelling, and physical tissue disruption naturally limits the area's ability to move or function normally. Novice tip. Observe for reduced range of motion, limping, or the inability to use a specific limb or joint, as you normally would.